Today's episode is sponsored by Vitality Health RX Supplements. Whether you're an athlete, a busy professional, or just someone looking to prioritize health, Vitality Health RX has what you need. With premium ingredients and rigorous quality control, their supplements support your body's natural functions. Visit shopvrx.com and use code FEELGREAT15 for 15% off your first order. Thanks to Vitality Health RX for sponsoring this episode. Now let's dive in.
Hello and welcome to Feel Better, Feel Great, where each episode we're going to dive into the wonders of holistic health and functional medicine to empower you with the knowledge you need to live a healthier, happier life. I'm your host, Dr. Andrea McSwain. Today we are exploring under pressure, blood pressure's hidden impact on health and longevity, where I want you to understand the vital sign of blood pressure, a topic that touches many lives and offers intriguing insights into understanding how pressure in the body affects our long-term health. Please remember that the information provided in this podcast is for educational purposes only. Always seek the advice of your physician with any questions you may have regarding a medical condition or your health objectives. Okay, why blood pressure matters. So this is really important. I think a lot of times we get into vernacular and we're like, okay, well, that's just like something we call it. But blood pressure is the pressure of your blood. So it means flow is involved, resistance is involved, perfusion. So how the blood gets into an area, right? And the other thing that we often I think blow over is the idea that this is a vital sign. So vitality, life force, etc. is really dependent on blood pressure. There are other ones as well, respiration, obviously, temperature, those heart rate, those are all really important. So this is one of them. So blood pressure really matters. And I think it is often called the hidden or the silent killer, but people don't really know what that means. And if they do what that means, they often think about it being too high. But time and time again, I meet people whose blood pressure is too low. So I want you to understand that this vital sign of blood pressure is a critical measure of heart and blood vessel health, so cardiovascular health, and it influences nutrient and oxygen delivery throughout the body, as well as the picking up of toxic elements like CO2 waste, etc., from the tissue, and then be able to remove it. So blood pressure involves getting the blood to the area to disperse nutrients and oxygen, and then to pick up CO2 and other waste products and move that, flow it out of the body. So when we look at hypertension, hyper is high, tension is exactly that. They're talking about pressure, resistance, that word for hypertension, and then low is hypo, low tension. This type, there's two, those are the main two, right? It's either too high, too low, just right. It's the one we're going for. And it can silently compromise quality of life. This contributes to chronic conditions and reduces longevity. The thing I want to say about that is when we look at what is in the just right or Goldilocks of blood pressure. Well, in 2013, the anti-hypertensive guidelines were produced and actually stratified blood pressure levels based on based on decades. So the blood pressure levels are based on decades. People who are in their higher years, like 70s, 80s, 90s, can have a higher blood pressure because they have hardening of the arteries. And then you wonder, well, that's not a good thing. Well, hardening of the arteries increases resistance so you can get the pressure up to the brain. So oftentimes as we start kind of losing the war on gravity, we want to make sure that we have enough blood pressure to get to our brain. And for example, in those antihypertensive guidelines, it was even noted that if an 80-something-year-old comes into your office as a doctor and the blood pressure is 160/90, it is not in the best interest of that patient to drive their blood pressure down significantly and quickly, because it will lead to hypotension and it will also lead to diminished blood perfusion to the brain. So that can then cause decline in thinking. It can also cause some significant balance issues and fall risks. That's important. So people ask me, well, what should my blood pressure be? And blood pressure, I think the sweet Goldilocks spot is 120/80. When I was doing those thousands of home visits, I would meet people who were on blood pressure medicine, and their blood pressure would be like 130, 140/80, and they were doing great. And then I would meet the really fantastic person who was doing fantastic in their home in their 80s. They were on no medications. They were definitely on a few supplements to help them with blood thinning and with fish oil and nutrient absorption. And I'll go on that in another podcast. But the idea is their blood pressure was 120/80 without medication. That is the sweet spot. However, when we look at blood pressure that is too low, and a lot of times I hear people say, people tell me my blood pressure is good, like 100/60. And I call that boneless chicken syndrome because they are floppy. They have no integrity. There's no tension or pressure in their blood. So they just kind of fall over. Sometimes they're so exhausted. So hearing your blood pressure is good is not enough. Hearing your blood pressure rating, and if it's 120/80 without medicine, you're in that sweet spot of this vital sign. If you're medicating and you're in your 70s, 80s, even 60s, and your blood pressure is more like 135, 140/85, 90 even, those are better spots than in being in that generation, 70s, 80s, even 60s, than having it below 120/80. That is very important because I meet a lot of people who are on a lot of blood pressure medicine and then they're falling or they're not able to function cognitively as well as they should. And that is problematic. So we need to recognize that where that sweet spot is. So definitely 120/80 is that sweet spot. Young people, like very young, like teenagers, will be pretty low in their blood pressure. 100/60 is fine if you're a 16-year-old female. But when you start getting into adulthood, you really are right around that 120/80 spot. So next time someone says your blood pressure is good, ask them for the numbers and make sure you know that. Now, how does it affect your your body? How does blood pressure affect your body? Well, when the blood pressure or the tension in the blood vessels is high, you're going to put a lot of strain into the body. It's not going to be able to get the blood supply that it needs, and that will diminish the blood supply to different organs. Now, that can include the heart, the kidneys, and the brain, as I discussed. And over time, without adequate nutrients, without adequate flow of oxygen, without adequate removal of waste products, there starts to lead to organ dysfunction. And is it often overlooked? Yes. Because as I said, a lot of times people just tell you what your grade is. Oh, it's good. But they're not actually telling you what's going on. And a lot of times, too, we kind of ignore this as part of our routine care or routine monitoring. When people monitor at home, it's important to use the cuff that goes on the upper arm. The wrist cuffs are just too variable. They don't really give you an adequate evaluation of pressure because they're too far away from the heart. It's important to take your blood pressure around the above the elbow so that you can get that information. What happens when people are taking high blood pressure medicine when I would do my home visits? Well, first of all, I would ask them, what are they eating for that day? And I would remind them that a lot of processed foods have sodium, and sodium produces elevated blood pressure and can actually be the root cause of hypertension. So it's the dietary issue there's a lot of sodium the person's eating, and then their blood pressure is going up. And I would meet people on 3-4 blood pressure medicines, and they still had high, even uncontrolled elevation of their blood pressure. And then I would go and ask them what they were eating, and we'd look at the labels. And you want to look at the sodium content label per serving. Really important. A lot of times a can of soup will have more than your entire sodium allotment for the day in 1 or even 2 servings. As a general idea to think about, and I've mentioned it before, if you have a half a cup of processed soup and a half a sandwich. That is the entire sodium load for the day. Sodium load in total is about 1,000 to 1,200 milligrams per day. Otherwise, it can raise blood pressure. And sometimes people are getting in 3, 4, 5,000 milligrams of sodium every day, and that will raise your blood pressure, because that's one of the things that sodium does, is it raises blood pressure. And we need sodium. It's part of our lives. It's part of every cell in our bodies. However, when we're getting excessive sodium, especially in our diet from processed foods, then we are definitely going to be having an elevated blood pressure. And this can be very hidden, or if it's found, sometimes then people will end up being on these multiple blood pressure medicines and not having their blood pressure go down. And then we're looking at all the medication side effects, because these medications are significant metabolic disruptors. So I want you to recognize that if possible. And then the other thing is there can be a role in genetic predisposition, of course. Stress. So stress, I'm going to talk about that a little bit more with your stress hormone related to blood pressure, but that is aldosterone. And it's a very important consideration for how some people handle their stress. The next I want to phase into hypotension, or low blood pressure. And what happens when blood pressure is too low? Well, this is typically when blood pressure is really under the 110s, over 60s. Now, some people will say even lower, like 90 over 60. And I don't know anyone who can function when their blood pressure is close to 90 over 60. In fact, it's a very significant problem that will probably have most people end up being in the emergency room, because it is a horrible feeling when your blood pressure is that low. And that is not okay. You really want that Goldilocks when it comes to blood pressure levels. What can happen when your blood pressure is really low? You can feel dizzy, you can faint, you can have extreme exhaustion, right? There's no tension in your blood vessels. There's no pressure in your blood vessels. And so we're not getting your organs perfused. We're not getting your muscles perfused. So then there's things like blurry vision. And then in severe cases, of course, when the blood pressure is very low, it can be an indicator of shock or severe organ damage. So that's what we want to deter, but we can think about that in a trajectory or a continuum and recognize that if people are struggling with low blood pressure for a long time, their organs are being affected and organ damage is happening. It's just on a much smaller level than what would be perceived in shock. Okay, so who's at risk? Young adults, obviously, like I said, sometimes medications that people be put on, especially if they're elderly. These medications can really tank their blood pressure. Dehydration can cause some pressure because the blood pressure is based on flow of blood, and that's a liquid, and that definitely can be related to dehydration. Hormonal imbalances, which is I'm just ready to get into in a minute. And then just understanding that some people do have naturally lower blood pressure. Usually when people are exercising and moving a lot, athletes, they can have a different blood pressure reading. So if you're a professional athlete or a very intense athlete, that's a conversation to have with your doctor. Now I'm moving into aldosterone. This is the stress hormone as it relates to blood pressure. It is an adrenal hormone, so it's made from the adrenals that are above your kidneys. It is crucial in regulating the pressure of your blood by controlling salt and water balance. There's a lot of things to play in that as well. How aldosterone works, its role is in signaling the kidneys to retain sodium and water while excreting potassium. And this directly impacts blood volume and pressure. When I meet someone who has adrenal fatigue or adrenal fatigue, what happens is they really, if they have kind of a proclivity to have an aldosterone imbalance, they're usually people who grip their hands and clench their face when they're stressed. So this is different than someone who has an adrenal imbalance and they have like a cortisone deficiency. aldosterone, when people have that, they really usually are clenchers. And so you could kind of see how they respond to that feeling of tightening and elevated blood pressure by actually having that stimulated with stress. So they get stressed, they kind of clench and tighten, and that is usually why they have elevated aldosterone. So elevated aldosterone is when the body produces too much aldosterone, and it can lead to hypertension as sodium and water retention raises the blood volume. Okay, what can also happen with elevated aldosterone is the body can sometimes make a cyst of it that's elevated and stays on top of the adrenal gland. And sometimes people have ultrasounds when their aldosterone is found to be elevated. They should to look for these adenomas or these glandular accumulation of products above the adrenals. That is the standard of care. When aldosterone is really low, it's called hypoaldosterone, and it makes the blood pressure really low, causes potassium imbalance, and it's very symptomatic, like fatigue, dizziness, muscle weakness. I think that they're both very symptomatic, whether the aldosterone is high or low. I do check aldosterone on almost every single patient. As you may recall, sometime before in a podcast, I said aldosterone is often called primary hypertension, and it's not supposed to be tested in the medical community per when I went to med school. And they just basically said, hyperaldosterone doesn't exist. It's only theoretical. So don't test your patients for aldosterone issues if they have any kind of blood pressure issue. Well, I think clinically I've dispelled that idea completely as I meet a lot of people who have this blood pressure hormone dysregulating their blood pressure. If you have a blood pressure problem, please have your aldosterone checked. Hopefully your doctor is aware of aldosterone and recognizes aldosterone as the blood pressure hormone and it will make sense to them to do that. A lot of times you have to go to an integrative or functional medicine doctor to have your aldosterone checked. I don't really understand that. It's pretty much makes a lot of sense and it's proven in science. But in any case, I've seen aldosterone levels quite high. I've seen them extremely low. Sometimes aldosterone can be quite high and then people can get very fatigued and it can tank. So that could be a little bit more of a confusing profile. But most of the time, if it's really high, we look about tissue perfusion, calming methods. If it's really low, I add licorice. So licorice is just a phenomenal way to support the blood vessels, and so is vitamin D. Vitamin D is very critical to blood vessel stability, along with licorice, not licorice that you eat, because that's just syrup and flavoring, but actually the true licorice herb. But that's a slippery slope, so you wouldn't want to self-medicate with that because you don't want to go from having too low of blood pressure to having too high. Again, you want to find that sweet spot. All right, and then again, the hidden costs of blood pressure imbalance are very present on longevity and quality of life. Looking at how well your organs function for the long term is very important. A lot of times in quick fix medicine, we're looking at, okay, your heart's starting to race now, or your kidneys are having a problem. Let's talk about surgery or dialysis, or, if your brain has a problem, well, then you're just kind of stuck with that because nobody's going to do brain surgery and there's not many things supposedly that can help with the brain. But there are actually a lot of things that can help with your organs when you start looking at blood flow, tissue perfusion, removing waste, adding oxygen, adding nutrients. So those are really important to think about. As these things become more impactful on your organs, they can cause severe stress. So even things like heart attacks can be attributed to blood pressure dysregulation, strokes as well. And if you understand what's happening in the body when these conditions happen, that didn't just happen overnight. Heart attacks and strokes don't just happen. It's a progression. So think about a dimmer switch turning on. And when we think about longevity, which I'm going to talk a little bit more in the next episode, we look at where are you on that longevity and quality of life spectrum so that we can keep you as healthy and happy as long as possible. All right, so what do you do? Regularly monitor your blood pressure. It's a good idea. You don't want to freak yourself out, and there's definitely white coat syndrome. One of the reasons I don't usually wear a white coat in my practice, because I want people to not have that kind of freak out response. I don't blame you. But I don't usually wear a white coat for that. When people look at how to test their blood pressure, the gold standard is for people to sit quietly, legs uncrossed, so no talking, kind of by yourself for 5 minutes to take your blood pressure. Well, I'm not so keen about that idea. I know that's the standard, and that's where you get the 120/80, and that's kind of perfect. When you go to the doctor's office and you have high blood pressure, what do they make you do? Lay down, don't talk to anybody, cross your legs. Why? Because they want your blood pressure to go down so they can check that box so they can get you, on your way. When people come into my practice and we check blood pressure, they are usually have been talking with me, or they're a little animated, they're just being themselves. They might have arrived recently, and so they might have blood pressure secondary to driving, blood pressure elevation secondary to driving. Whatever it is, I like to consider that an active blood pressure. There aren't really any metrics on active blood pressure, but I like to know what your blood pressure is doing when you're moving around. I still look for that 120/80. Clearly, this is my own way of doing things. However, I believe that's a little misrepresentative of your blood pressure if you're sitting there doing nothing for 5 minutes and your legs aren't crossed and you're not talking. So probably your blood pressure is going to go down. But I want to know what your blood pressure is going to be, because usually when people are having heart attacks, it's because they're shoveling snow, or they're raking, or they're exercising, or it's Sunday and they're getting fearful of that they have to go to work on Monday, right? People who are stroking, they're yelling, they're screaming, there's tons of tension. So it's not the blood pressure that's like passively, peacefully when you're sitting there, which might rarely happen in your own life. It's the actual blood pressure. So take that for however you want, but please recognize there's a very classic way of doing it, and then what I call is the very real way of doing it. Again, looking at some actionable items, so lifestyle, please look at how much salt you're taking in. Monitor your sodium for a few days, or even one day, and even one meal. If you're having 3 slices of pizza for lunch and, I don't know, something salty with it, chips, for example, or you're having chips and a sandwich and a bowl of soup, you have like double the amount of sodium for your entire day in that one meal. It's going to raise your blood pressure. Okay. When we look at stress management techniques, that's a big conversation. I say exhale first. I always say exhale first, because you get kind of that reduction in tension, and then you'll let the air in, and that will give you a nice way to have flow, and that will help with stress. And of course, healthy, regular exercise that makes you smile and feel good. Low blood pressure, often a very significant sign of dehydration. First, check your medicines. Are you on Lasix, or it's also called furosemide, or any other diuretics like hydrochlorothiazide, or those, and then loop diuretics. So are you on something that's a diuretic that may very well be dehydrating you? Because to diurese means to urinate, to lose fluid. And so you might be dehydrated, and that might be causing you low blood pressure. There are sometimes too, when people go from laying to sitting, sitting to standing, and they notice that they have that feeling of wooziness. So that's another example of hypotension and another symptom. Again, hydrate, look at your salt, because that can still cause imbalances. The other thing is, please take vitamin D3 with K2, because sometimes if you have a chronic infection, your body will become hypotensive. And when you become hypotensive from a chronic infection, oftentimes the blood vessel is leaky because it's inflamed. It's inflamed and there's an infection in your body. Taking vitamin D3 with K2 will help your blood vessels. It's not the only thing, but it's definitely a very significant thing. It's researched, it's there. So please. Then when to seek medical advice. Basically, Seeking medical advice is one thing. Seeking integrative advice is another, right? First, you want to get to your lifestyle pillars. So how well are you sleeping? Are you totally stressed out nonstop? Are you grabbing for another cup of coffee? Have you had any water today, right? Again, are you eating lots of processed foods and getting tons of sodium, which is causing your blood pressure to come up, et cetera, in those kind of dynamics for your lifestyle pillars. So sleep, eat, move, stress, and relationships. Is there someone you're talking to and your just blood boils or blood pressure raises when you talk to that person? And you might need to be working with someone to help you to understand how to work on that particular relationship. And that's a great way to seek medical advice. Again, blood pressure is more than just a number. It is a vital sign. It is critical to your health and long-term well-being. And I can't wait to dive in on more topics like this. So thank you very much. I would love for you to subscribe to my podcast. Please leave a review. Please share it with your friends and family who might benefit from our discussions. And a final thank you to our sponsor, Vitality Health RX at shopvrx.com. I'll say it a little bit slower, shopvrx.com. We do have a special going on for this holiday seasons. So I look forward to you visiting our website there. And then again, thank you for your ongoing support. Until next time, stay healthy and feel great.